Hey guys, you're welcome on here. It's a pleasure to have you. Thank you for logging on. This is Essay, your topical get topical with Essay. So we've had so many news in our nation, Nigeria, and all around us. But just a quick one on some of the very topical ones. Number one, I'll be taking is the strike by the resident doctors in Nigeria. It's no news that we've been hearing that these doctors, they've been planning to embark on this strike for a very long time as a result of lack of PPEs, especially this pandemic period, and also other welfare packages that has been promised to them by the federal government and the labor, but they never get to them. Recently they eventually embarked on the stretch started from June 15, 2020. It has commenced, but for now those doctors in the various COVID-19 centers are exempted. That notwithstanding, they will definitely join them in the long run. But it's really be very worrisome situation and so many questions for so many people in Nigeria, like why is the Nigerian government and also the labor or the labor ministry, why are they really doing this to Nigerian workers, especially the health system? We know how significant this system is, but to say that on the very minimum some of the things they need to do their work is not available, and also remuneration for these people is very on the low as compared to what you hear or see their counterpart in other countries, even in West Africa. Like, they begin to wonder. So it is no news that we also have a lot of brain drain, like a lot of doctors, they leave Nigeria every now and then, and we hear testimony stories of how they tell their colleagues, you know what, they're just suffering in Nigeria after spending so much time in school to study. Nigeria really do not value the doctors we have. They don't value the resources we have. This has been a long time and an ongoing situation. But the reason or the question is, why is Nigeria government like this? Taking care of her human resources the best way they can is a big problem, and giving them what they need is actually a very I'm just going to read one of the very reliable news from the Nigerian doctors on strike over lack of PPE and welfare concern. Meanwhile, this is majorly for those in the public sector. Doctors are state-run hospital work at, but medics at COVID-19 will continue working, the union says. Like, if you've been following on news with them for a very long time, you know that these people have been appealing to government to at least provide for them what they need this time, to also compensate them where allowances, hazard allowances and other allowances are accrued to them. I was listening to the news this morning and I saw one doctor like, no, over and over, these people, the politicians or whoever is in charge come around, they promise them, they tell them, you know what, we're going to give you this, but they never get it. Like, it is really, you cannot treat your people, you treat your citizens this way, you treat your workers this way. I think this is really becoming out of hand. Why so many people are of the opinion that, oh, you know what, doctors are very insensitive to embark on a strike action. No, it is not that way. If our politicians can use billions and millions to build infrastructures for them, their office, where they stay, where they live, their allowances, and talking of one of the very profound institutions, the medical institution, public health care and what have you in the country, these are the shambles. I think it is time people begin to appreciate each other. But I'm going to just read some extract from a very reliable news. Like I say here, doctors in state hospital have gone on strike over complaints of welfare and inadequate protective equipment, but have said medics treating COVID-19 patients will keep working. Okay, let me just go down a bit. The decision to commence on a total indefinite strike with the exemption only for COVID-19 treatment center has taken place. The National Association of Resident Doctors, which represents some 40% of Nigeria's doctors, said in a tweet. Okay. The reason why they want their counterparts in the COVID centers to be to still be working is because medics did not want to deprive COVID-19 patients of care, at least a very large extent. That is very understandable. We are treated unfairly. He warned that they will be forced to join the action if the government refused to meet the demands within 2 weeks. Yes, I think this kind of demand, since they're not ready or willing to use the initiative to make workers happy in this nation, such demands would be actually meted out on them, especially now that citizens are beginning to speak up. And I also watched in the news this morning, like I was mentioning, one of the doctors was saying specifically, I think he's the president in one of the chapters, and you know what, he has in time past bought some PPEs just because of his empathy and because this is the call of his job. But meanwhile, you cannot continue to do that. They cannot continue to do that. What about other doctors that do not have the resources, that have a lot of expense to do, that has also other responsibilities? So let's be very, very sincere on all this, and also know that they need this increase. They need to be treated fairly well. Can you imagine, after spending so much years in school, after coming out to provide health services with even not just the PPEs, aside the PPEs, medical infrastructures are very limited. And at least the least you can do is to make sure these people are available, so that if we have any emergency, or we have any patient, they are there at least to provide quick and necessary care for the patient. And in the same way, I also saw the president of the Labour saying we are going to meet the needs as soon as possible before the end of the week. He should do that. We need to see that they do that. Also, let's talk about sorry, I was a bit very hard on that, but we have to be. The time has come when we have to let our politicians know that the way we are treated, people are not treated that way. We should be treated beyond that. Yes, this is our country, this is our nation. Because they have the right and the privilege to lead us, do not mean that we have to be run over by them, forgetting our basic human rights. Okay, another story I would like to talk about is on COVID-19. Well, in one of my, if you see my cover book for the month of June, I wrote that one of the things I was going to talk about is individual responsibility towards COVID-19, because over time we've realized that this sickness or this disease, like we've been saying, hearing, it's one that will definitely come and stay with us for a very, very long time. So for that reason, people have been advised over and over to take their personal hygiene very high. It is left to us to do what we can do to stay alive. So, and the PTF raises concern over breach of guidelines. Presidential Task Force on COVID-19 warns that relaxation of restriction order does not mean that life has returned to normal. Expresses concern over high level of interstate travel breach. Like this is by air, by land, by sea. What of you? There's a breach of all this, and even the people within the states just feel, oh, COVID-19 has disappeared into the thin air, forgetting that the cases keep increasing every day. And this has come from the attention of the government has been on this, and now they're advising everybody, you know what, COVID-19 is real. And that is even where it comes from. People think, oh, you know what, COVID-19 is not real, and sometimes they ask you, have you seen anybody who is infected, who has been affected? That does not mean it is not real. You have to be, first of all, even believe. It is time for people to desist from being the doubting Thomas and believe that this virus truly exists, and that the least you can do, or the best you can do for yourself and your family, is to adhere to the simple rules. When you're going out, go out with your nose mask, have your hand sanitizer in your bag, maintain social distancing, and what of you, then maintain a very, very thorough hygiene. Wash your hands as much as you can when you have to do. I know some of the stores around, people around you have designated places, like almost nearly everywhere. We have some of these amenities very ready, and the least you can do, protect yourself. So it is all on individuals. If you have been watching critically, you realize that the government had failed. Number one, a total lockdown, there was no palliative for people. Even those who could not afford things, they had to struggle and suffer during that period. If you've seen all of that and you feel, oh, the government has your back in this, they don't have anybody's back. And that is the truth. You need to take care of yourself. The only back they have is that they have the center available, but the center is not available to everybody, because at the last time we know that it was really getting overfilled. Some of the centers were overwhelmed. So it is left to individual. Wherever you are, be an ambassador to your family. Let them know that whenever they are going out, the best they can do is to go out with their nose mask and protect themselves, because if they go out and they return it, the chances that those in the house will also get it is very, very real. These are some of the very, very topical stories we have. We have other stories. We have the Edo State fracas, what is happening in Edo State. The governor of Edo State had just resigned from APC. well, it's not been said the party he's moved to now. Well, I've not gotten the party he's moved to, but he has resigned. You've seen that a lot of these days since Democracy Day, June 12th, you're hearing stories about, oh, democracy, how is democracy in Nigeria? Are we really practicing democracy? Have they divided the world into demo and crazy, and every other thing is just going as out of what proportion, what is happening in Edo State? So many youth people are beginning to really think of democracy, think about democracy, think about governance in Nigeria. We also saw stories last weekend about the national budget, what the federal government they are doing, or what the budgeting office they are doing. Infrastructure, the money for infrastructure quite lower than what they have on governance. And over time, people have said, you know what, the cost of governance in Nigeria is very high. That is why there is never an equilibrium. That is why the ordinary people do not, because what is left for infrastructural development is very lame, that it cannot cater for these needs eventually. So these are some of the things happening in Nigeria as at today. We have very other news, but all the same, I'm going to share some news in another of the video that will be uploaded very soon. So people, this is Nigeria, it's our country, it's for us. If you're watching from any other part of the country and you have news about Nigeria, you need to clarify yourself, you need to know, you know, to talk about, please let me have all of that in the comment section. So, and for us Nigerians, you have feedback for us and or some of the things I've mentioned and others you want me to also know about, I'd like you to help me with them in the feed and in the comment section. So I'm your topical girl, Essie. It was a pleasure having you join me on today's edition of Topical Issues with Essie. Thank you so much for your time. I do have a very, very pleasant Tuesday. Bye bye.